Hi, I'm Dr. Kristina Dervaitis, an obstetrician gynecologist in Newmarket, Ontario. Welcome back to my channel devoted to answering questions about intrauterine contraception. In today's video, we're going to talk about the subject of IUD removal. What's involved in this process? What are some of the frequently asked questions that I get about IUD removal? I'll start by saying that removing an IUD, whether it be a levonorgestrel or copper IUD, is generally a very simple procedure. Probably I'd estimate it takes less than 2 minutes if there's not any issues or complications to deal with. The vast majority of patients are able to have an IUD removed very quickly. It simply involves inserting a speculum and then visualizing the cervix and the IUD strings. An instrument is used to grasp on to the IUD strings. The IUD is gently pulled basically from its uterine position, and it's really just as simple as that. I find a lot of patients after an IUD removal appointment, it almost seems anticlimactic to them. They say to me, "That's it," because for whatever reason they were expecting more of an ordeal, but really it's quite simple. The cramping is very minimal from this process, and there might be some light spotting or light bleeding afterwards, but usually very minimal. So when you're coming to have just an IUD removal, it's very different from the actual IUD insertion process. Now, in terms of who can perform an IUD removal, most general practitioners and nurse practitioners would feel comfortable in removing an IUD. This can be done in a GP's office or in a walk-in clinic, or some circumstances might require that an IUD is removed in the emergency room. Some GPs might not feel comfortable removing an IUD and may send you back to the original gynecologist who did the procedure, and that's absolutely fine. If a patient is having an IUD removed specifically because they're having problems with the IUD or concerns about possible side effects, those sorts of things, I really would request that patient come back to me for the IUD removal, or whoever the gynecologist was that inserted the IUD, just so we can have the opportunity to talk about those symptoms and side effects first before we do the removal. Because in some situations, after I've had a conversation with the patient, it actually turns out that the things that are bothering them or worrying them are not actually related to the IUD at all. And so the patient leaves the office having decided to continue forward with the IUD. So if you're having difficulties with your IUD and that's what's prompting you to want to have it removed, definitely see your gynecologist to discuss things further prior to removing the IUD. In terms of fertility after removal of an IUD, as I've mentioned in previous videos, although most IUDs are good for 5 years, they certainly do not need to stay in for the entire 5-year duration and can come out at any time. And basically, as soon as we've removed the IUD, whether it be copper or levonorgestrel, essentially the next month when that patient ovulates, they are capable of conceiving. There's not any delay in return to fertility. And so I do remind patients that if we're removing an IUD for the purposes of going forth to try and conceive, that those patients should start taking a prenatal vitamin immediately, because the goal is to have exposure to the folic acid right at the time of conception and not after you've discovered that you're pregnant, because the folic acid is important for preventing neural tube defects like SPINA bifida. I also wanted to mention that for those patients who are having an IUD removed because it has now reached the 5-year expiry date, or 3 years, whatever the case may be, depending on the IUD, it is definitely possible to reinsert a new IUD at the same time as that old IUD is being removed. For those patients, I don't require pre-procedure lab work. I explained in previous videos that in most of my patients, I require that 24 to 48 hours prior to an IUD insert that they have a lab pregnancy test to reassure me that I'm not inserting an IUD into a pregnant uterus. Here, with an IUD already in place, I can be very, very confident that the patient's not pregnant, and so that additional step is not necessary. And so with the procedure, I would simply remove the previous IUD and then immediately with the same speculum exam at the same time insert the new IUD. And I'd refer you to my previous video on IUD insertion for the step-by-step instructions about IUD insertion. After an IUD is removed and a new one is inserted, the patient may again experience a brief 4 to 6 week adjustment phase where there might be some light bleeding, mild cramping, but generally whatever experience they had with the first IUD, they can usually expect to have a similar menstrual cycle bleeding pattern eventually with the replacement IUD. So in some situations, we may be in a circumstance where the patient has come to me saying that my GP looked with a speculum when I had my pap test done, or because we were trying to remove the IUD, and the strings were not visible. This happens in a small percentage of patients and usually isn't a great obstacle to overcome in terms of removal. Often the GP will have ordered an ultrasound just to confirm that the IUD is in proper location. In those situations where yes, indeed the IUD is where it should be, but just we can't see the strings coming out of the cervix, oftentimes the strings are just slightly tucked within the canal of the cervix and really require just some gentle prodding. I have different tools available to me as a gynecologist than your family doctor might. And so really those patients the GP would send to see me, and in the vast majority of cases, I am actually able to retrieve the IUD strings from within the cervical canal and remove the IUD without difficulty. So not seeing the IUD strings doesn't necessarily mean any sort of cause for panic, but definitely would mean that you'd be coming back to myself or your gynecologist for removal of the IUD. Now, in very, very rare circumstances, there may be a situation where, whether it's related to not being able to see the strings or other reasons, where we might not be able to remove the IUD in the office. And again, I want to stress that this is very unusual that this would happen, definitely in less than 1% or 0.5% of patients, very low. In this circumstance, one strategy is to refer the patient for a specialized ultrasound to be performed at the same time as the IUD removal. The ultrasound is called SONO hysterosalpingogram. Basically, this is a fancy term for saying that during the ultrasound, we would be putting a slight amount of fluid into the uterus to help us better visualize things. And using that technique, the gynecologist performing the actual ultrasound can use the ultrasound to help guide him or her as we attempt to, using different tools, remove the IUD under ultrasound guidance. And in our area, we've been really fortunate to have a specialist who has that skill, and I not uncommonly have sent a patient or two to that clinic, and there has been success in removing the IUD without any further steps taken. The last very, very rare situation, and again, I would probably say less than 0.1% of my patient population, is those patients that even despite a Sono HSG guided, ultrasound guided attempt at removal, the IUD for whatever reason is having difficulties being removed. And in those patients, we might recommend a very brief sedative, an anesthetic in the operating room, just so that the patient can be more relaxed and allow us to do what we need to do to remove the IUD without too much discomfort. Very lastly, I just want to bring up the issue of IUD self-removal. I didn't actually even know this was a thing until I did some surfing on YouTube of other videos out there, mostly from patients and not physicians, talking about the idea of possibly removing the IUD at home on your own. I will simply say that I don't recommend this. I don't really see that there would be a reason for you to try to do this at home on your own. Again, it's a very simple 2-minute procedure that can be done in almost any physician's office or general practitioner's office. It doesn't require referral to a specialist necessarily. But all I'm going to say on that front is my professional opinion would be to not attempt IUD removal on your own at home. Please do make an appointment with your gynecologist or your family physician to have this quickly and safely done in the office. So those were just some tips and comments on IUD removal. I hope this video has been helpful. Once again, as I do at the end of every video, I'll remind you that in less than the time it took for you to watch this video, you could have had an IUD inserted because the whole process takes about 5 minutes and would give you 5 years of worry-free contraception. That's all for today. Thanks for watching. We'll see you in the next video. Take care.